Children are more sensitive to negative health impacts of air pollution because their lungs are still growing, their immune systems are still developing, and they tend to spend more time out of doors than adults. People in Ontario are not exposed to very high levels of outdoor air pollution compared to many other places around the world, but there is still a lot of variation around the province. Just think about going for a run near the 401 highway versus canoeing in Algonquin Park. That's a big difference. So what's the situation for kids in Ontario? Are they in the clear because Ontario has low air pollution levels overall? Or is there a detectable sign that they are experiencing negative health effects? In our study, we chose to look at children's family doctor visits for some conditions that are thought to be impacted by air pollution. They include asthma and seasonal allergies, as well as acute respiratory infections and ear infections. We found that throughout the year, increases in the concentration of tiny air pollution particles were associated with more family doctor visits for the conditions we looked at compared to average Ontario rates. This suggests that air pollution, even in the low levels we see in Ontario, might be contributing to negative health effects in children. Of course, there are also other factors to consider, other reasons why we may have seen the results we did. One reason could be that cities have higher air pollution levels than rural areas, and kids in cities are more likely to have, and be brought to see, family doctors compared to kids in rural areas. We tested this possibility by doing the same analysis that we did for asthma and other conditions, but instead focused on injuries and stomach flu. Injuries and stomach flu probably aren't related to air pollution, so we wouldn't expect to see a strong relationship. Indeed, the relationship that we saw was not as strong as the one we saw for asthma and other conditions, and might have been due to chance alone. This makes us more confident in the results that we saw earlier for asthma, allergies, respiratory infections, and ear infections. This research suggests that the health of Ontario children could be improved by reducing air pollution in areas with relatively high levels. However, because this is just a preliminary look at these relationships, it is important to do further research in the area. For example, are lower income children even more at risk than their higher income counterparts? And can these results be generalized to the rest of Canada? Even though Canada has low air pollution levels, there is always room for improvement, especially when it comes to the most vulnerable members of our population.